to in effect sell things that people really don't need, it is just corrosive. And so the other thing is that it's kind of a one-time sale. So when we would have a patient and they would come in and they would think that they wanted Botox, but they didn't have any wrinkles. And our patient or our, physicians would go in and say, you really don't need Botox. First of all, they would really, sometimes they'll try and actually get that. But you say, look, there's nothing that's going to be a benefit. You're going to waste, $300 or $400. And you're going to drive no benefit from this. You do not need this. Come back in 6 years when you're starting to develop crow's feet and we'll talk. Well, what happens when you do something like that is your trust, in effect, just goes through the roof. And it doesn't matter that they did not get that treatment from my clinic at that time, because within the next 3 months, I'm going to see them again. I mean, we saw tens of thousands of patients in our clinics, and that is almost invariably the case, is that when you have that level of trust, I mean, cosmetic medicine is a desire. And the fact that you didn't give somebody a treatment did not quench their desire to do something. Often, it's the case. I'll tell you one story is, our very first clinic came out of, originally was a pain management clinic. And so you had a lot of people in there, and it amazed me what would happen. We had a patient come in, and this is a patient that was probably tipping, 90. She was probably 90 years old. She was in a wheelchair. She had probably about 6 months to live. She was in a tremendous amount of pain, and she wanted laser hair removal for the hair on her upper lip. I mean, of all of the possible things that she might need, this was very, very important to her. Now, I can speculate on the reasons, and we probably can all figure out, exactly why she might want this or not. But it is the case that, cosmetic medicine has a very large kind of powerful draw for most people. I mean, I would, tell our physicians, look, we're in the vanity business. That's really what we are. We are not here saving lives. There are times when we are going to do a tremendous amount of good. I remember one patient came in and she had a birthmark. This is actually a good, interesting story. She had a birthmark that covered probably about a quarter of her face. On the right side of her face, she had a very, these deep purple birthmarks that went up. It covered her ear completely and went up kind of the side of her face. Super noticeable. I mean, it was basically as though her face was, a quarter of it was like bright purple. And she came in, and we went through a number of treatments. I think she had 6 or 8 treatments in order to treat this. And in effect, unless you actually knew that it was there, we got rid of this. And that literally changed her life. And in some very odd ways, one of the things that she became extremely conscious, that people would actually look at her when they would talk to her. And there were tears. We literally changed her life. She was a 35-year-old, mother, and had always had this, since she was born, and had always grown up with people looking at the kind of the right side of her face when they kind of talked to her. I mean, it was almost impossible not to, because it was so distracting that. But when we got rid of that, that literally changed her life, Or if you're a 16-year-old high school girl and you come in and we treat you for acne, and we're able to help you kind of manage that, so that you're, the high school abuse or those types of things stop. That literally can change somebody's life, especially in those kind of formative years. High school kids with acne with severe, acne that you can actually kind of help is both challenging. Acne is a challenging treatment modality for sure, but is also extremely rewarding when you're able to actually do that, because it's different than, Botox or treating somebody's crow's feet, right? That's just personal to them. It's not really going to change their life dramatically, but occasionally those things will happen that make you feel, they're pretty good, feel good moments.
Right, well, shall we move on to this interview with Setu Mazumdar?
Let's do that. Let's see what Dr. Mazumdar has to say.
So let's just do a little bit of background on Setu. He was the valedictorian of Woodward Academy, and then he attended Johns Hopkins University. He earned his Doctor of Medicine in Johns Hopkins School of Medicine. And then he went on to also doing a lot of financial stuff and investments. Interesting guy. Let's have a listen to the interview.
So, Setu, you are both a wealth manager, a financial planner, a certified financial planner, and an ER doc. How did that kind of come about?
Well, I think it kind of goes back to when I got out of residency. I finished my emergency medicine training in 2001, so this is, I guess, my beginning of my 10th year in practice for emergency medicine, and the whole transition kind of came about through a couple different avenues. When I got out of training, I was making probably around $35,000 a year in residency, in my last year of residency at the time. And all of a sudden, in 1 month, in July hits, and I started getting a real job, and then my income went up by over 10 times. And so, like many physicians, I thought, well, gosh, making all this money, surely if I went through all this training through medical school and residence and everything, that I can certainly handle my own investments and pick the winning stocks and all that kind of stuff. And the reality is after a couple of years, I realized that, one, I really had no clue what I was doing, because we basically didn't have any sort of training. I can't even recall a single hour in medical school or in residency, not even a single hour on the business aspects of medicine, and certainly not on financial planning.
You would think that medical schools would understand this problem. Why isn't that the case?
Now, I'm not exactly sure why that is, but my opinion on the matter is that when you go through medical school training and even residency training, the vast majority of these training centers are academic centers. And so while you get great medical training, there's very few people in academic centers who've actually run a physician's practice, for one thing, and secondly, they were basically trained themselves in a situation where they didn't get that training to begin with. So it's hard to impart something, knowledge of something that they themselves didn't have any knowledge of to begin with. What I kind of find fascinating is probably one of the biggest things that concerns physicians when they get out of training are business practice management issues and then their personal finances. But to me, it's pretty amazing that none of that's really covered at all in a medical school curriculum, and certainly not in residency training. My opinion on the matter is probably that since these are mostly academic institutions, the attendings and the faculty who work in academic institutions don't really have a grasp of these issues to begin with, and so it's not really integrated into part of the curriculum, when in fact it's really a big part of our personal lives. To me, it's not just that you have medical training. Once you get out, you really have to integrate your career with the rest of your life. And by not focusing on the rest of your life, I think is a huge gap in medical training right now. And I think it's going to continue to be. I don't see how that could be changed based upon the curriculums I've seen in various medical schools and residencies.
Well, it seems that every physician should understand this. These are often one of the first kinds of questions we end up talking about, has to do with business or finance or money in some way. You would think that all of the physicians, including the ones that are the academics, would understand that there's a kind of a gap there and kind of move towards filling it, even if it was just by providing some opportunity for residents and physicians that are in training to get this kind of an education or help.
I agree. I think there should be at least some sort of basic financial planning and business management courses or lectures or some sort of even hands-on sort of training and residency, but it just doesn't happen. It certainly didn't happen to me, and even speaking to the graduates who are coming out of training who've contacted me, who've read my articles and other things, asking them, they even say that even now that's just not the case, that they didn't have a single amount of exposure to any of this stuff. And it goes way beyond that. For example, emergency medicine, which is my specialty, one of the big things in emergency medicine is that very few emergency medicine physicians are actually owners in their practice. They're generally independent contractors. And so they have no ownership whatsoever. So when people get out, they're basically sort of like hired guns, basically. There's very few democratic groups, and the whole issue of, how do you form a democratic group, what's the advantages of having your own practice or ownership of it, is not even discussed, except maybe for a couple of places. I went to a residency program that actually did discuss that particular issue, since my residency director was actually one of the founders of the American Academy of Emergency Medicine, which really kind of focuses on democratic physicians groups. But beyond that, it's really not something that's discussed really much in the medical circles, at least not in the training. It's all about, all the academic stuff and not all the other stuff that factors into your life after you're done.
So you graduated, you started making some money, and then playing around in the stock market and stuff, and realized that you didn't have the information and knowledge that you thought you needed at that point.
Yeah, there's a couple issues. One is, like a lot of physicians who get out, they say, well, if I went through medical school training and I went through residency training, this grueling training, then picking the winning stocks and picking the right mutual funds and all this stuff is easy. And then what I realized after a couple of years was, one, I had really no clue what my returns were. And secondly, I started reading all the academic studies and academic research in portfolio management and financial planning, and that's when it hit me that everything I was doing was wrong. But there's a second motivation here as well, which is that not only was I doing it wrong and I had no clue, my colleagues who were all physicians didn't have a clue either, for two reasons, or two aspects of that. One was if they were managing it themselves, they were making the exact same mistakes that I had made. And the other issue, which was probably really fueled my passion to go into this, was that a lot of physicians who had financial advisors had advisors who basically were not acting in the physician's best interests. And to me, that was shocking because as a physician, morally, ethically, and legally, we're always required to act in the best interest of our patients, whether it's in the ER, whether in the office, in the ER, urgent care, clinic, wherever you work. That's kind of our legal and moral duty. The problem with most financial advisors is that that is not the case, and it's perfectly legal to do it that way. And so I was seeing all these physicians who had these advisors who basically were trying to sell them products and get a commission off of it, which to me doesn't resonate with objective advice. And I was seeing a lot of physicians who had been ripped off and burned by so-called professional financial advisors who, in fact, were only trying to sell them stuff. So I kind of took a look at this and I said, I've got this incredible passion for this. My assets have grown because I did a good job of saving, and I'm seeing these physician colleagues of mine who basically weren't getting any sort of objective advice. Wouldn't it be a great idea for me to use this passion of mine to be an advocate for physicians, but on the personal financial planning side? And that's how kind of the whole thing blossomed into what it is now.
Now, was this something that you had a seed around starting some other business other than clinical practice in the past, or was this really something that your plan was to go into clinical practice and then you saw a need and decided at some point that you could address it?
Actually, when I got out of residency training, I really had no idea I was going to do this. My goal was, okay, I'm just going to work really hard and do as many shifts as I can and make as much money as I can. But you bring up a good point is, why would you change from one thing to the next? And I think the other thing that happened to me personally was that as the years went by and as, I got married and I had kids, I all of a sudden started to question, okay, yeah, I'm making all this money, but I was almost somewhat miserable about it because I wasn't really enjoying it. You had night shifts and weekends and things that I was missing. And so I took a big step back and said, okay, hold on. What really makes me happy? Is it doing all these nights and making this money, or is it spending more time with my family? And, of course, I chose the second. Now, basically what I'm getting at is that my I kind of had this big transformation between myself and my relationship with money and what it means and what is